Want to know why? Ask how. Howard the Humongous. As of September 4th, 2020, we had hit 188,000 deaths from the coronavirus. By the time you see this video, that coronavirus death toll will probably be 200,000 or more. For comparison, that is more than all deaths in a comparable period of time from the common flu, auto accidents, household accidents, and murders combined. In fact, it's more than twice as many deaths. Many of us are hoping that we will find a vaccine and everything will go back to normal. And many of us fear that President Donald Trump will rush a vaccine out before Election Day to make himself look like a hero and increase the landslide of votes he is hoping to achieve. We fear that this vaccine won't be thoroughly tested and will do what the swine flu virus that President Gerald Ford rushed out in 1976 did. The New York Times has revived the Ford story as a cautionary tale. In 1974, Gerald Ford was minority leader of the Republican Party in the Senate. Richard Nixon's vice president, Spiro Agnew, was mired in scandal and was forced to resign. According to the 25th Amendment of the Constitution, Gerald Ford had just become vice president. But that wasn't Gerald Ford's only lucky break. On August 9, 1974, Richard Nixon was forced to resign in disgrace, and Ford became president. But Ford's hold on the White House was precarious. He was the first president in American history never to be elected as either a president or a vice president. And the Democrats were determined to defeat him in the election that was looming in November. What's worse, a peanut farmer from Georgia named Jimmy Carter became the Democrats' presidential nominee and was, of all things, far, far ahead of Ford in the polls. Then, in February 1976, an epidemic of a new flu from Asia, a new avian flu, broke out at Fort Dix in New Jersey. The CDC calls it an explosive febrile respiratory disease outbreak. It infected 230 soldiers, hit 13 with severe respiratory disease, and killed one. The experts had been anticipating a pandemic like the one that had killed as many as 100 million people worldwide from 1918 to 1920. That was the Spanish flu. Now, the new Fort Dix virus, called the swine flu, looked like it might kick off that long-feared pandemic. So Gerald Ford and Congress went into emergency mode. Ford asked Congress for $135 million for a crash program to develop a vaccine. The vaccine that came out of this effort looked promising. The race was on to stop the swine flu before it could kill hundreds of thousands. And Gerald Ford had another challenge: to deliver a vaccine in time for the election, the first election in which his position in the White House would be challenged, the election in which he was competing with Jimmy Carter in order to secure a second term as president. Reports Virology US. In March of 1976, President Gerald Ford announced a program to inoculate every man, woman, and child in the United States against swine flu. And Ford and his public health experts rushed the vaccine's approval and its mass production. Then Ford made the incompletely tested and incompletely double-checked vaccine available to the first lucky 45 million Americans. That vaccine gave 440 of those who were immunized an illness that crippled them for life, Guillain-Barré syndrome. And the inadequately tested vaccine killed more than 30 people. The program stopped dead in its tracks, and hopefully America learned a lesson. We can't let the swine flu vaccine fiasco happen again. But today, Americans are dying at the rate of 360,000 people a year and over 1,000 people a day from the coronavirus. And that rate is expected to go up when fall comes and our bodies are forced to fend off the coronavirus and the common flu simultaneously. So a vaccine against the coronavirus could be a lifesaver for you and me. But what's actually happening with a coronavirus vaccine? Normally, development of a vaccine can take up to 28 years. The president, yes, President Donald Trump, the man of a million lies, has initiated a program called Operation Warp Speed. Its goal is impossibly bold: to give us at least one COVID-19 vaccine by January 2021, just 4 months away. And Bill and Melinda Gates are pitching in. Is Trump's Operation Warp Speed for real? Very little of what he does is. The answer appears to be yes, it is for real. Operation Warp Speed, according to Trump's Health and Human Services head Alex Azar, has invested $10 billion so far with the goal of delivering 300 million doses of a COVID-19 vaccine by January. That's almost enough for all of America's 331 million inhabitants. Azar reports that 3 Operation Warp Speed vaccine candidates are in Phase 3 trials in the United States. A Phase 3 trial normally involves only 3,000 participants, but Azar says that each of the companies picked is recruiting 30,000 to 50,000 volunteers for Phase 3 trials of its vaccine. Azar may be overstating things, but not by much. For example, the drug company Pfizer, which hopes to know if its vaccine candidate is effective by late October, has enrolled 23,000 people in its late-stage clinical trial, hopes to reach 30,000, and has already given many of these people both an initial and a booster shot, speeding them toward the point where the vaccine's effectiveness can be proven or disproven. Which means that Operation Warp Speed may be the biggest recruitment of volunteers for vaccine testing in history. In addition, Operation Warp Speed is underwriting the manufacture of the basics you need to ship and administer a vaccine: vials, stoppers, needles, and syringes. A very wise move. A move that proves the value of the so-called deep state, the civil service that President Donald Trump has not yet been able to demolish or to fill with his sycophants. It may also prove that thanks to that deep state, some Trump programs can be effective. The Health and Human Services Administration gives concrete details of Operation Warp Speed in a timeline on its website. What are that timeline's highlights? On March 30th, the Health and Human Services Administration announced $456 million in funds for Johnson & Johnson's vaccine candidate. On April 16th, HHS made up to $483 million available for the Cambridge, Massachusetts drug company Moderna's vaccine candidate. 3 months later, HHS tossed Johnson & Johnson another $472 million to support what it called late-stage clinical development, bringing Johnson & Johnson's total to nearly $1 billion. On May 21st, HHS announced up to $1.2 billion for the British company AstraZeneca's candidate vaccine, developed in conjunction with the University of Oxford. The agreement was to make at least 300 million doses of the vaccine for the United States, with the first doses delivered as early as next month, October. Other companies whose vaccines Operation Warp Speed is supporting include Regeneron, Novavax, Sanofi, Pfizer, and GlaxoSmithKline. But creating a new vaccine that works is not enough to save your life and mine. Building a factory that can make a new vaccine in quantity normally takes 5 years, and each vaccine demands a different kind of factory. But Operation Warp Speed is underwriting the building of these factories before any of the vaccines have been proven. The hope is that one or more of the vaccines will turn out to be effective and safe. This is a very smart and very necessary gamble. Then there's the Bill and Melinda Gates Foundation, which is funding the building of factories for 7 different vaccines and intends to finally narrow the number of vaccines it produces down to 2. But the trick will be to test these vaccine candidates before they ever get to you and me. Why? As the New York Times puts it, clinical trials almost never succeed. In tests, some promising-looking vaccine candidates actually help the virus seize control of your system and make you more sick, not less. It's called vaccine-induced enhancement. And in the 1950s, in one trial with a potential polio vaccine that had been rushed through approval, the vaccine candidate actually gave kids polio. In fact, several test subjects died. That's why promising but dangerous vaccine wannabes are ruled out thanks to test results. It takes tests on thousands of people over the course of a substantial amount of time to find these negative impacts and to weed them out. Hopefully, Operation Warp Speed won't shortcut the testing process and give us a vaccine that doesn't work, that only works occasionally, or that does us more harm than good. This is Howard Loom speaking to you from the future. It's your job and my job to make. Or, want to know why? Ask how. And now for that infamous, slimy, sleazy, sneaky, villainous little off button. I can't find it. Where the hell is it? It's here someplace.